Hello, I'm Akila George, and today we will discuss some advanced symptoms that arise from heart disease like etherema or anthoracitis reactions and pruritus at bite sites. Heart disease is caused by the parasite Dermatophragmitis, which is transmitted by mosquitoes. Once inside a dog's bloodstream, the larva matures into worms that grows inside the heart and lungs, leading to severe health issues. Heartworms are transmitted, which are through mosquito bites, where the skin may slow erythema redness, imperitis, which means itching, before the larva enters the bloodstream, and once inside, the larva migrates through the subconscious tissue before reaching blood vessels. I also wanted to the terms of that what we just discussed. Erythema is redness of the skin, often caused by increased blood flow due to inflammation. Pruritus is itching or an uncomfortable sensation on the skin that induces the desire to scratch. It is commonly seen at the site of mosquito bites before the heartworm larva enters the bloodstream. Now I'd like to go over life cycle and transmission. A mosquito bites an infected dog and picks a tiny heartworm larva, and when the mosquito bites another dog, it infects the larva into the bloodstream. Over 6 months, these larvae grow and mature into adult worms inside the heart and lungs. So after a larva are injected, they travel through the subcutaneous tissue, eventually reaching the bloodstream. As the heartworm matures, they cause inflammation in the blood vessels, which can lead to vasodilation, which is expansion, and vasoconstriction, which is contraction, as the body responds to the infection. So some of the key terms that I went over is subcutaneously, which refers to the layer of the tissue just beneath the skin. In heartworm disease, the larva migrates through this tissue before reaching the bloodstream and other internal areas of the body. Vasodilate, the process by which blood vessel expands, often to respond to inflammation or infection. And vasoconstriction, the process by which blood vessels narrow or contract, typically as it reaches it to reduce circulation and other stressors such as heartworm cause damage. Now I'd like to go over symptoms and diagnosis. Dogs with heartworm disease may have resistance, cough, fatigue, difficulty breathing, and a swelling abdomen. Vet diagnoses heartworms using blood tests and chest x-rays, which can show worms in the arteries. Advanced heartworm disease can lead to edema, which is swelling, in the limbs or the abdomen due to heart failure caused by the worms blocking blood flow. Dogs may also experience alopecia, which is hair loss from excessive scratching due to allergic reaction, and exudate fluid leakage may form at mosquito bite sites. When diagnosing, radiographics can show heartworms in various views of the thoracic cavity, dorsal or ventral, and reveal how the worms affect the cranial and caudal regions of the heart and blood vessels. Some of the key terms from that is edema, which is swelling caused by the accumulation of fluid in the tissue, often seen in the limbs or abdomen as it results in heart failure or blockage in the blood vessels caused by heartworm. Alopecia is hair loss, which can occur when the dog excessively scratches the skin due to itching from allergic reaction, such as those triggered by mosquitoes bites or the presence of heartworms. Exudate, fluid that leaks from tissues or blood vessels into the surrounding areas, often associated with inflammation or infection. It may appear around mosquito bites, indicating a skin reaction. For treatment and prevention, treatment for heartworm disease is costly and risky, involving months of injections to kill the worms. Prevention is much easier. Monthly chewable medications or topical treatments can keep dogs safe. Mosquito control is also critical. Treatment aims to reduce anemia and improve circulation in both the cranial and caudal regions of the body, which can become compromised due to the worms. Some of the key terms that I would like to announce on that one is cranial, which refers to the head or the upper part of the body. In heartworm disease, the cranial region of the heart is typically where the heartworms are initially found. The caudal refers to the tail or lower part of the body. As the disease processes, heartworms may extend into the caudal vena cava, a large vein that returns blood to the heart. In summary, heartworm disease is preventable but deadly if untreated. Regular vet checkups and preventive medications are the best way to keep your dog safe. By preventing heartworm disease, we can avoid severe conditions like anemia and alopecia and prevent critical issues such as blockage in medical blood vessels and distal limb circulations. Thank you.